Today we have CPC for dental caries. This is the first case. A 25-year-old female patient reported to the dental clinic with mild pain in her lower left posterior back tooth region since 2 to 3 weeks. She gives history of restoration with the same tip 1 year back. This is the representative radiograph. Okay, can you read this radiograph? Read the radiograph. What can you see on the radiograph? Okay, this tooth. Okay, first this tooth. That is first molar. What is this radiopaque area? Okay, in the second molar, this radiopaque area? Below the restoration, what can you see this area? That is the radiolucency below the restoration representing recurrent caries. Recurrent caries means what type of caries?
Occur for the second time.
So what do we call it? Recurrent caries or secondary caries. So what is primary caries? That is the first attack on the tooth surface by the caries is primary caries, and if the caries occurs below the restoration or second time, we call it as a recurrent or secondary caries. So what could be the etiology for this? Please don't talk among yourself. What could be the etiology?
Leakage.
Yes, one factor.
Gap between the restoration and the tooth.
Yes, one thing, either the clinician has not removed the caries completely, that is he left behind some part of caries. Second, either there is gap or there is poor adaptation of the restoration margin, which is acting as a source of accumulation for the plaque and food, leading to formation of acid, leading to the caries. So what will be your treatment for this patient? What you will do?
Removal of restoration.
First, remove the restoration.
Preparation again.
Yes, preparation again means you will remove the caries. Followed by re-restoration. This is the second case. A 4-year child patient reported to the dental clinic with his mother with the chief complaint of decay in the upper anterior region. His mother gives history of prolonged bottle feeding. What is your clinical diagnosis looking at this picture? Rampant caries. In that, what type of caries? In children. Acute caries is rampant caries. It will involve multiple carious lesions. What is the name given to typical this type of lesion occurring in toddlers or small young children? What is the name for this?
Bottle caries.
What bottle caries? Nursing bottle caries. Okay. What is the etiology for it? What is the etiology for this nursing bottle caries?
During the night,
What else? That means only not during night time, even during the afternoon nap time or during night, the toddlers or children, they are fed with the bottles containing sweeteners or juices or milk. So because of that, this constant source of sugar or carbohydrate is available to the plaque bacteria for a very long period of time. Okay, leading to formation of large amount of acid in close contact with the tooth, leading to caries. So here, can you give one chair?
We cannot sit after Kailangan may
دكاترة كلام. دكاترة الاستماع خير من الكلام.
So, in this picture, can you see typically the maxillary anteriors are affected, whereas mandibular anteriors are spared. So, what is the reason for it? Why these teeth are not affected?
Protected always by the tongue.
Yes, one thing, protected by tongue and constant cleansing action of the tongue while sucking the milk or any sweetener. Second, saliva from submandibular gland, which is constantly cleaning, mechanical cleansing as well as buffering action of the saliva. So what will be your treatment for this patient? What kind of treatment you will give? Depending on the lesion. Looking at this picture, what would be your treatment for this patient?
Drink water after milk.
Okay, that is protection or prevention.
Just drinking.
What
What
else?
are alternative for drinking? Why do they get caries? Because of the bottle. Why? Attachment of the milk to the surface of the teeth. What happens to the milk? When milk gets fermented, what will happen? It will release what? Lactic acid. And lactic acid is the main cause of caries, okay? So you have to prevent the attachment of the milk to the surface of the teeth. So a piece of cotton or gauze dipped in water and cleaning the teeth after feeding is fine. That's for breastfeeding and also for the bottle feeding, okay? And try not to give the child milk while the child is asleep, because when he leaves this, one of the other problems that happens is middle ear infection. That's a common problem with the children which are bottle fed. They take the bottle and they sleep. When they go into sleep, the milk will leak from the corner of the mouth to the ears. And that's a common problem that will have these children. They have middle ear infection. Otitis media is very common in these children, okay? This is the prevention of the disease.
Okay, suppose this patient comes to you, what kind of treatment plan you will provide? That is about prevention, not to cover with the crown. So before giving crown, what you have to do here, this is exposed pulp chambers. So what you will do directly, you will put the crowns over it.
No, remove the caries.
Remove the caries. And if this is a pulp exposed, then yes, pulpectomy. That means you will do RCT depending on the extent of the caries lesion, either only coronal pulp, that is pulpotomy, or complete coronal and radicular, that is pulpectomy, complete removal of the
If
pulp.
the root is not completely formed, would you do pulpotomy or pulpectomy?
Pulpectomy.
Which one would you do and why? You have to tie everything to clinical. We teach this so you put it into the clinical practice. If you have a tooth, canine for example, and the root is incompletely formed,
Suppose for
what
this
would you
tooth.
do? What would you do? Pulpotomy or pulpectomy? And why?
Pulpotomy.
Huh?
Pulpotomy.
Pulpectomy? Huh?
No.
What's pulpectomy and pulpotomy, doctor? What's the difference? Sani, I want her to
Yes.
answer, please. I want her to answer. تفضل. What's pulpotomy and what's pulpectomy? Total removal of pulp in the coronal and the radicular, okay? So what's pulpotomy? Removal of the coronal bulb only is pulpotomy. If the root is not completely formed or less than 2/3 of the root is not formed, you don't do pulpectomy, you do pulpotomy. So this is an indication, contraindication. تفضل. Go ahead.
So after that, after pulpotomy, you will do the crowning. Why do we need the crown? Why I cannot extract this tooth? Because we will get a
Yes, sir.
they will act as
What
a
will
space.
happen?
Yes.
Malocclusion. It's not just crowning, malocclusion. Okay?
That
So we
means
call it space maintenance.
maintenance.
Okay? You maintain the space. Even if you have a missing tooth, you put a space maintainer to keep the place for the permanent successors to come. Okay?
That means these teeth will act as a space maintainer. That's it. For the
So, what is the adult counterpart of the not nursing bottle cares? The adult counterpart, يعني المثيل بتاعها في الأدلت.
another
And what
example for
condition?
rampant
Okay.
caries.
Rampant caries in an adult,
In
middle-aged patient. Radiation what? Radiotherapy, not just radiation, because a diagnostic radiology does not cause a rampant case, only with a therapeutic radiology, okay, or therapeutic radiation to head and neck cancer, okay? Why does it happen? Why? Why do you get rampant caries or radiation caries?
Saliva.
What happens to the saliva?
Decrease the
يحصل ايه؟
velocity.
يحصل ايه؟ hyposalivation or xerostomia?
Xerostomia.
Xerostomia. So what will happen as a result of xerostomia?
Bacterial
Stomatitis, fissuring, bacterial infection, fungal infection, what else? Periodontal diseases, all of these things are complications of hyposalivation or xerostomia, okay? Good.
And in caries, the role of saliva, whatever it is playing, mechanical cleansing, buffering action,
Yes.
antimicrobial, everything
IgA,
will not,
protein
yes,
IgA,
everything will not be there. So,
peroxidase enzyme, lactoferrin, there is like 12 factors out there, okay?
okay.
Does any of you know what's the role of lactoferrin in caries resistance? اللي هتجاوب السؤال ده هتاخد درجة كاملة. What's the role of
Of
lactoferrin in prevention of delta caries?
One chart you.
I think Dr. Barty gave you this,
Yes,
right?
one
You
chart.
gave them all the antimicrobial
Yes.
agents and such. One of them
One
is
chart is
lactoferrin.
given functions of saliva.
يلا اللي عايز تاخد درجة كاملة 1 point she should answer. What's the role of lactoferrin in prevention of caries and other infectious diseases in the mouth?
He gave the answer to you.
I'm sure you get it.
No, you only gave. If you can get the clue.
Do you want me to explain the answer and I will get 1 point myself, okay? The role of lactoferrin, it depletes iron from the medium. Iron is very important for the flourishing and growth of bacteria. If there is no iron in the medium, so the bacteria will not grow. So this is one way of depleting the iron from the medium, the free iron, not the bound iron, the free iron, so the bacteria cannot grow and multiply. Okay, that's the function of lactoferrin. So what's the function of peroxidase? That's another antimicrobial agent. I'm sure you gave peroxidase as well,
Yes,
right?
doctor.
يا جماعة والله الشارts والحاجات دي they are for you to learn and this is you should put some questions in the exam in this. The antimicrobial effects of all the factors present. Okay?
Yes,
I'll make sure that you have those in the questions. What's the function of peroxidase enzyme يا دكاترة؟ يا جماعة الخير العلم بيتقدم مش عارفين peroxidase. What's the function of peroxidase? It splits water, gives you free radicals. So it gives you what? The hydrogen group and the peroxidized group, the OH and the H group. The OH group acts as what? It's a bactericidal. It destroys the bacterial cell wall, so it kills the bacteria. So you have to know lactoferrin. What's the difference between secretory IgA and serum IgA? They know that. They should know that, right?
Secretory IgA, and this difference I did not tell them.
Oh, you didn't.
But in function, it is mentioned.
Yeah. Okay.
What is the
Type
function?
all function of secretory IgA, and I'll tell you the difference between.
Microbiology.
They have taken that.
Microbiology and immunology.
They have taken that. They have taken. What's the difference between secretory IgA and serum IgA? وليه ربنا سبحانه وتعالى خلى في secretory IgA and secretory IgA؟ لازم ليها حاجة. Think. طيب is IgA a monomer or a dimer? This is microbiology and immunology. IgA is what? IgG is a monomer or a dimer?
Monomer.
Very good. IgA بقى. IgG is monomer. امال IgA؟ It's a dimer يا دكتورة وجوينت من الاثنين لا مش كده؟ طيب ايه الفرق ما بين السيرم والسكريتري؟ اسم secretory يعني ايه يا دكتورة؟ It has something called secretory component. Secretory component دي it's added and it acts as a part for giving resistance to the molecule. That's why the secretory IgA it can function inside the stomach with a gastric HCl for 1.5 hours. شوفي برضه حكمة ربنا إن في الأورال كافيتي معرضة للديفرنت structures ولما تنزل حتى في السtomach it still acts for 1.5 hours. That's why secretory IgA is much stronger, more effective than serum IgA. فاهمك الحتة دي؟ تاخد secretory IgA, serum IgA, and you don't know the difference. حاجة اسمها secretory, حاجة اسمها serum, who cares? There is a rule وفي حكمة لربنا في كل حاجة اتخلقت. احنا بنحاول حتى نعرف حكمة الخالق، مش كده؟ خير. خلاص؟
can go through the slides.
Okay, go through the
What did you
slides.
have?